And joining me now to continue our discussion on cancer initiatives and lay out her strategic plan is the White House Cancer Moonshot Coordinator, Dr. Danielle Carnival. Dr. Carnival, welcome to this conversation. Thank you so much for being with us.
Thank you so much for having me. Good to be here.
So let's talk very specifically about the goals that the president put in place over the next 25 years. What are they?
Yeah, so President Biden and the First Lady earlier this year reignited the Cancer Moonshot that they started in 2016 and set out bold new goals to decrease the death rate from cancer by at least 50%, over the next 25 years, and to improve the experience and the support for patients, caregivers, family through living with and surviving cancer.
As we've been talking about, every American has been touched by cancer one way or the other. Certainly the president with the loss of his son, Beau Biden, to brain cancer, making this a very personal issue for the president and the First Lady. But I'm curious if during the COVID-19 pandemic, did that in any way slow down the cancer research that is going on? And is it now the right time to kind of, as you say, reignite the research and initiatives that we're trying to put into place?
Well, it's definitely time to double down and reignite the progress that we've seen over the last 25 years in over the last 2 decades in decreasing the death rate from cancer by 25%. Really gives us a map of how to accelerate that and make a difference for millions of Americans going forward. The COVID-19 pandemic did impact research outside of the work that was being done to combat and get in hand the pandemic, but it quickly bounced back. Funding for the National Cancer Institute, which is the primary funder of cancer research, was always there, always moving forward, and making an impact on reaching these goals and on really driving innovation and new ways to prevent, detect, and treat cancer.
How do you make sure that there are no silos when it comes to the research, that that's broken down and that all parties, whether it's public-private partnerships, medical institutions, schools, and hospitals, are collaborating when they find new discoveries, new research, new therapeutics?
A couple of things. One, we're starting with the federal government. So part of the answer to how we're going to accomplish the president's vision for the reignited Cancer Moonshot is let's bring all parts of government together and make sure that we're not creating silos between the great research that happens at the Department of Defense and Veterans Affairs, along with what happens at Health and Human Services, Department of Energy, like we just heard from, and many others. So we started by getting our house in order. There's also policy decisions that we can make that helps to incentivize and really enable collaboration. One example is earlier this year, the administration put out a new rule where research that is funded by federal taxpayer dollars, when those publications come out, they need to be freely available to everyone. You don't need a subscription, you don't need to pay, you don't need to be an expert. This is taxpayer funded research. This started with cancer in 2016 and now applies across the federal government to federally funded research, a really important step. But the other thing is calling on people's best interests. You heard a little bit from the doctor on how much we're understanding about cancers and how specific some of these cancers are. That means that one physician will not see enough of them to make progress alone. So the science is really driving collaboration in new ways as we understand more about this disease.
As you know, we're in the middle of a midterm election campaign, and one of the issues that continues to come up, the disparities between more urban areas that have access to the right type of health care and rural areas. When it comes to cancer, can you address that disparity? Are there disparities, and are they being addressed?
There are a number of disparities in access to early detection, in access to prevention, and in access to clinical trials and excellent care. That yes, are zip code based in some cases, are race or gender or ethnicity based in other cases. And so a real focus of the Cancer Moonshot is We need to drive innovation to find new ways, additional ways to prevent, detect, and treat cancer to reach our goals. But we're going to get a lot of the way towards our goal by making sure that more Americans have access to the great tools we already have and those we develop along the way.
Is there a price tag for all of this over the next 20 to 25 years?
I think to start, there has been historically very strong bipartisan support for biomedical research and specifically the National Cancer Institute and the work on cancer. We expect that to continue to go forward. I think what we're looking to do is say, we want to bring the same level of innovation that applies to cancer research to how we think about prevention, to how we think about making sure healthcare reaches more people, to how we think about making sure that early detection reaches more people. So we hope and expect to see more investment in those areas going forward.
As I mentioned, this is personal when you talk to the president. You've certainly talked to the president and First Lady. What are his marching orders to you, and how does he convey what he went through, as so many other millions of Americans have gone through over so many years?
Yeah, I mean, the priority from the president, the First Lady, the vice president, most of the cabinet was shown at the launch event or the reignition event in February. They were all there. They are all showing up to the cancer cabinet meetings and making sure we're driving this forward. So it's not just the president and First Lady's personal experience, it's all of ours that is really driving this work. But I think an important thing to note is he has talked publicly about some of the things they saw going through their own personal experience with their son, and the First Lady all the way back to the 1990s when she had a number of friends diagnosed with breast cancer at the same time. They, from that experience, have kind of exposure to what some of the issues are, and that drove how we talked about breaking down silos, making sure patients and families are really in the driver's seat and have access to their medical information so that they can make the best decisions, that clinical trials, which are really the leading edge, especially in some cancers where standard of care isn't making the difference we want it to, are available to more people. They firsthand saw some of these issues, and that kind of started our agenda. And then we did a lot of listening to make sure that the priorities that we were setting really matched what mattered to people directly impacted by this disease today.
I'm curious, in our remaining few minutes, if you can point to areas that you are most encouraged about. You're a neuroscientist, where you think we're going to make the biggest progress and when.
Yeah, I think the exciting thing is we have so many more tools today than we had even a couple of decades ago. We have a vaccine. You asked about vaccines. We have a vaccine that prevents the cause of up to 7 types of cancer in the HPV vaccine. If we had widespread uptake of that vaccine, we could eliminate cervical cancer. We could take an entire cancer pretty much off the map. That's exciting to me. We can develop more less invasive tools for detecting cancer early that can reach more Americans and take down some of the barriers to people who can't take a day off and get that colonoscopy, or don't have a ride to get there, or are afraid that it'll be too expensive for them, which shouldn't be, because the Affordable Care Act really took on preventative and early screening, and that should be covered for recommended screenings for people. But I think what we focus on, yes, I'm a neuroscientist and the science is really exciting, but how do we translate that faster and in an more impactful way to changing people's lives, to improving outcomes, to making sure they get that cancer detected earlier, so that we have more tools while we're really pushing the boundaries of these precision medicine directed treatments that the doctor talked about, that are less harmful and get people back to their lives even faster. Let me say one thing. I know that I'm painting a very positive picture. We know that the impact of cancer is still devastating on 1.8 million families across the country every year. So we don't have enough, but we are excited about the progress that's been made and are laser focused on making sure that reaches more people.
Also devastating is ALS, Lou Gehrig's disease. You've been involved in that as well. And I'm wondering, different situation, but the same concept when it comes to research and development and potentially cures. What did you learn from your work there? How do you apply it at the White House today?
A couple things. One, I've dealt with people facing illnesses. I've lost a parent to cancer and other members of my family. I thought I really had an understanding of what it meant to stand up and fight for them and be an advocate for them. But the ALS community is a whole different story. They've impacted me in ways that I will never be the same in how I want to live my life, but also how I approach barriers that we could remove, that we could make progress against, that will make a difference. There's just incredible neuroscience work being done. A drug just got approved for ALS just about a couple weeks or a month ago. I just hope for the ALS community that that's a crack in the wall and really shows that this is possible, and that we can do something for the tens of thousands of people facing that diagnosis.
So you have technology companies, you have research hospitals, you have NIH. Your job is to coordinate all of this. How do you do that? How does it all come together? What is your job specifically?
Yeah, I mean, you described it well. We worked with as many people in the community, from researchers, technology companies, biopharmaceutical companies, academic institutions, patients, caregivers, survivors, public health officials, really everyone that touches this disease, and says, if this is our North Star, the president wants to accomplish these two goals of cutting the cancer death rate and improving the experience. What do we need to do in your opinion, to get there? And so the Cancer Cabinet has broken that down into 5 areas of: close the screening gap, understand and address toxic and environmental exposures, drive innovation, decrease the impact of preventable cancers, and support the patient and family. And so that's really our shared agenda for everyone across the country, not just across the government, to say, how can I step up and be a part of it? We have a website, whitehouse.gov/cancer-moonshot, where people can share their ideas, their stories. We know how much that impacts kind of the compelling stories of struggle and hopefully triumph, impact people paying attention to these issues. But we also have a section where people can share new actions and new collaborations that they want to contribute as part of this mission, as part of this movement that is the Cancer Moonshot. And so we are really excited to see those ideas and to have everyone be a part of accomplishing this and making progress for people all across the country.
And as you pointed out earlier, this is a bipartisan issue with support from Democrats, Republicans, certainly from the White House and from Congress. But as you measure the metrics moving forward, what will you specifically be looking for?
Yeah, I said it briefly earlier, but the quantifiable goal that we have to stay on track to decrease the death rate from cancer by at least 50% over the next 25 years, year over year, we're going to see how we're doing against that. And I think that is going to be a telling sign as to the progress we're making. And what I'm excited about as part of that is we're going to be able to adjust our strategy. We have data-driven efforts and design as to how we think we're going to reach that goal. A lot of it's in prevention and early detection. A lot of it is decreasing inequities, in addition to new tools we couldn't even imagine today. But we're going to have to keep checking back in and making sure that the balance of how we're focusing on that is really making a difference. And you talked about the bipartisan nature. The 21st Century Cures Act in 2016 was a robustly bipartisan measure that invested $1.8 billion additional dollars in the Cancer Moonshot in this fight. The bipartisan infrastructure law isn't only building new roads and bridges, but it's cleaning up water pipes and toxic sites, Superfund sites that'll make a difference in prevention. The Inflation Reduction Act is capping out-of-pocket costs for seniors on Medicare that are facing cancer and other diseases. So there's a lot of congressional action that's a part of this, most of it hugely bipartisan. So we're excited to see that keep going forward.
And Dr. Carnival, I just want to begin on a personal, because you indicated your own situation, losing a parent to cancer. What did you learn about the disease as a daughter?
Yeah, so I unfortunately lost my stepmother to the same disease that Bo faced, glioblastoma. And so I wasn't only kind of working in policy at the time, but I was a neuroscientist. And so I think it really puts you in the situation of any American facing that diagnosis for yourself or your family. I had a lot of knowledge on the brain and things related to that disease, but that all kind of gets wiped away, and you're just a kid trying to fight for the best outcomes for your parent. And so I think what I hope that translates to is not just in me, but in everyone from the federal government side working on this, that we can't understand anyone's individual specific situation, but we can relate to that experience because so many of us, nearly all of us, have gone through it ourselves.
And Dr. Carnival, you are confident we'll get there in the next 25 years?
I am. We do have to accelerate from basically double the rate of progress that we saw over the last 2 decades. But because we've really opened the aperture and said innovation in research is a huge part of this, but innovation in really how we care for people, how we prevent cancer, how we detect it early is a part of it as well. And that's really going to accelerate our progress.
Joining us from the White House as the Cancer Moonshot Coordinator, Dr. Danielle Carnival, thank you very much. We appreciate your time on a busy day. Thanks for adding your perspective to this very important conversation.
Thank you so much for having me and for the focus and attention on this.